Hello, this is Andrew Merritt with ProLiance Orthopedic Associates. Today we have a video of a repair of a bucket handle medial meniscus tear. Now this individual sustained an ACL tear as well as a bucket handle medial meniscus tear, which is a unique type of tear where the inside meniscus tears all the way from the front to the back and flips into the middle of the joint. This will give a step-by-step guide of how we go about doing the repair on that medial meniscus. I hope you enjoy and thank you for watching. This is the arthroscopic appearance of a knee, and what I have is a probe, which is a way for me to feel the tissue within the knee joint. And I can feel right there the ACL, which he does have a tear, and then the meniscus tissue of the medial meniscus. Now the meniscus tissue should always be to the far outside aspect of the knee joint, and here you can see it's in the middle of the knee joint where it is not supposed to be. So it has actually flipped from the outside of the knee to the inside middle portion of the knee. When I look back to where the meniscus should be, I see the remnant tissue, and this is the healthy tissue that is left behind and still attached to the outer capsule. This is where the meniscus tissue should be that is flipped into the center portion of the knee. We can see the remaining tissue there, and there is some tearing, and it's also a pretty small amount, meaning the majority of the tissue is flipped into the notch here. Reduction of this tissue can be pretty difficult, and this is why when they get stuck in the middle portion of the knee joint, they tend not to go back without surgical treatment. There you can see with the probe, I have to push pretty hard to get the meniscus back, and that is while holding the knee under stress, opening up the medial compartment. I start to evaluate the meniscus to see if it is able to be repaired and fit back into its normal location. You can see in the front portion of the knee joint here, where the meniscus had flipped on itself, that there's a little bit of incongruity in how it wants to fit, and so we will have to address this with sutures later during the repair. The repair occurs after making an incision on the back portion of the knee joint. What we do is we feed these long needles through the meniscus and into the back of the knee, where we retrieve the needles and pull the suture into place. This is relatively tedious to get us the exact location of the sutures that we want. Here I am passing the second suture, as I've already passed the first one, into the back of the knee, and now we will pull the second suture into the back of the knee. Once I remove this cannula that helps us position the needle, you will see that the suture pulls back the meniscus nicely. I have already placed one other suture in the back of the knee to hold back the meniscus, and now I will pull in the second suture, and you can see that we can start to pull the torn fragment of the meniscus back to the healthy portion of the meniscus. This process continues from the back of the knee to the front of the knee. In this situation, I placed 9 sutures into the knee joint and into the meniscus for the repair. This works generally stepwise from the back portion to the front, and you can see here as it pulls the tear together. That is the line between the previously torn and displaced tissue and the healthy tissue remaining. And as we pull this suture into place, that gap and the tear slowly diminishes. Here's another suture being pulled through, and you can see how this affects the meniscus by pulling it into the healthy tissue. One of the things that we encountered in this tear is that there was the flipped portion of the frontmost meniscus that needed to be tucked under. And so what we do is we put some sutures like this one underneath the meniscus to help pull it down, and we call this a balanced repair. We put a couple of these sutures along the meniscus so that it would be held into the right place. Once all the sutures are placed, we tie them over the outer capsule. Once they are tied, we check range of motion of the knee and stability of the sutures in the repair. I use the probe again to feel the meniscus and make sure it's held down in place. And here you can see it resembles a normal meniscus except for all of the sutures that are in place. This was pulled back very nicely, and the tear has compressed nicely with the sutures. The sutures go all the way from the front of the knee to the back of the knee in the bucket handle type tears. This is the standard repair of a medial meniscus tear with a bucket handle displacement. This is Andrew Merritt from ProLiance Orthopedics, and I hope you've enjoyed this video of repair of a bucket handle medial meniscus tear. Thank you for watching.